You are using a cannula and you are sucking the fat cells out.
That's the general idea behind liposuction, and as you can see, it's not exactly easy on a patient. As a result, recovery is typically rather lengthy as cosmetic procedures go.
Just bruising and pain, it just gets uncomfortable. Most patients it takes about a week before they're really feeling great.
Dr. Robert Jackson, an Indianapolis cosmetic surgeon, should know. He's been doing the procedure almost since it came to the United States. He was also the first to perform liposuction in the state of Indiana. He uses all of the latest technology available. But when he saw a Colombian surgeon introducing something new into the mix, you could say he was skeptical at the very least.
To be honest with you, most of us who watched the technique and watched his slides kind of thought it was snake oil.
The technique Dr. Jackson is speaking of is called laser-assisted liposuction. Essentially, it involves pre-treating the targeted area with a low-level laser. It's something that has been used in medicine for decades.
The low-level laser has been used since back in the late 60s, early 70s to stimulate wound healing, for pain.
But for this latest use, the Colombian doctor claimed the laser helped the fat dissolve more easily. That meant less work to remove it and less pain for the patient. So again, Dr. Jackson became a pioneer of sorts, becoming the first surgeon in Indiana to try laser-assisted liposuction and perhaps resolve his snake oil theory. The patient he selected was Marion, Indiana wine importer Margaret Bouchard. She had traditional liposuction before with Dr. Jackson, but was ready to target another area.
He shared with me he was going to be doing something new and experimental that hadn't been done before. Very eagerly I said yes. There was some discomfort and pain on the first one. Bruising was a big thing.
Margaret was hoping this time recovery would be different with the help of the new laser technology.
I was hoping no one would see these people running this red light over this patient in the operating room because I thought they'd think I was crazy. But then I started doing my liposuction, and sure enough, the fat came off very liquid. It was very different.
When she woke up, it was very different for Margaret as well.
One of the first things I asked when he and his nurse walked in the room was, "What'd you give me for pain? I don't have any pain." And he said, "I didn't give you anything for pain." And I looked at his nurse and I said, "Margie, is he telling me the truth?" And she said, "Yes, he's telling you the truth. I had no pain." I had very minimal bruising the second time.
Margaret was one of the first people in the country to see what this laser technology can do when combined with liposuction. It's a procedure she thinks has even re-energized her life.
The second one was just unbelievable in comparison to the first one. Gives you a whole new lease on life. I now play volleyball, I sail a boat, and I'm just enjoying it.
Now, many others are taking part in a nationwide study that could ultimately make this technique part of the traditional liposuction procedure.
If we can develop a technique which makes it more comfortable for the patient, less painful for the patient, and the patient gets better results, I think it may be the wave of the future.